Hi, my name is Noor Akbaradian, and I am presenting on vitiligo. So, what is vitiligo? Vitiligo, also known as leukodermia, is a disease that causes loss of skin color in patches. This is caused by dysfunctional melanocytes. So, some characteristics, this is a cell-mediated response causing melanocytes to get destroyed, forming macules, and macules are flat, distinct as colored areas of the skin. This can affect all parts of the body, but especially those affected and exposed to the sun. Because of the sun's UV, it can damage the DNA in melanocytes, and this disease is non-lethal. So incidence, 1.8 to 2.9 million people in the US have vitiligo, and 1 to 1.5 of the world's population have it. This does not cause death, and generally all cases are caused by having another autoimmune disorder. Historical. Vitiligo comes from the Latin word vitellum, which means small blemish. Earliest mention of vitiligo dates back to 1500 BCE in an Egyptian medical text called the Ebers of Papyrus. The Greek historian Hydorus in 5th century BCE believed that people with skin conditions were punished by the sun and therefore exiled from the community. And in the 1870s, an Australian scientist, Maurice Kaposi, first observed the lack of pigment in cells, and in the same decade, Gerard Hansen identified the bacterial cause for leprosy. And the reason that this is significant is because they both have leprosy and vitiligo both result in skin being different, and people kind of thought they were the same thing. So people that, even though people with vitiligo aren't sick, people would look at them and think that, oh, they're sick, and then therefore outcast from the society. So mechanisms for induction. People that tend to have vitiligo usually suffer from another autoimmune disorders like Addison's disease, psoriasis, rheumatoid arthritis, type 1 diabetes. In the absence of another autoimmune disorder, vitiligo does not affect the health or physical function of the body. Therefore, it's really just a cosmetic disorder. It can be inherited, but that's only seen in 7% of the cases. It can result due to variation in genes. Specifically, there are over 30 genes occurring in different combinations that have associated with the increased risk of having vitiligo. Two of these genes are the NIRP1 and the PTPN22. The NIRP1 provides instructions for making a protein that is involved in the autoimmune response, helping to regulate the process of inflammation. The body stops the inflammatory process to prevent damage to its own skin. So in this case, this gene would be dysfunctional and it would allow damage to its own cells. The PTPN22 provides instructions for making a protein involved in signaling that helps control the activity of immune cells, called T cells. Variation in these genes make it difficult for the body to control inflammation and prevent the immune system from attacking its own cells. Also, I saw in a couple articles that recently a woman and I think a few other people that got the COVID-19 vaccine developed vitiligo due to molecular mimicry. And also a trigger event such as stress, severe sunburn, or skin trauma such as contact with chemicals can induce this reaction. So types of vitiligo. There are two main types. There's generalized, which originates from an autoimmune abnormality, appears on more than one area of the body, and can be symmetrical, most common and progressive. And the subcategories are vitiligo vulgaris, which is characterized by small, flat, white-colored spots with a wide distribution on both sides of the body, typically affects the face, armpits, elbows, hands, knees, and feet. Acrofacial vitiligo, which is affected on the skin of the face and hands and around the body openings such as the eyes, nose, and ears. And vitiligo universalis. This is a rare type of vitiligo that causes over 80% of the skin pigment to be gone. The other type of vitiligo is segmental pigmentation of skin in an asymmetrical pattern that only affects one specific area or side of the body, typically before the age of 30. This stops progression usually after initial presentation, which means it does not continue to spread like generalized does. Other types are mucosal, which affects the mucous membranes of your mouth and or genitals. Focal, which is a rare type where the macules develop in small areas and do not spread in a certain pattern within 1 to 2 years. And trichome, which is causes a bullseye like white center, and then there's another like circle which is lighter but not as light as the center, and then it's like your normal skin tone, so it kind of looks like a dartboard in a sense, where it like kind of like pans out in color. So the cells involved, with vitiligo, there is typically a higher percentage of B cells in the body, especially those who have recently developed the disease. In active vitiligo, there is also an increase in circulating memory B cells and a decrease in naive B cells. B cells produce antibodies and autoreactive T cell cytotoxicity, and also have been shown to be involved in the disappearance of melanocytes in vitiligo. Vitiligo is characterized by an imbalance between the Treg and T effector cells, with impaired Treg functions and increased proliferation of CD8 positive and CD4 positive T cells. Melanocytes are more sensitive to oxidative stress, and in vitiligo, an increased ROS production can result from external stress. Stressed and damaged melanocytes can release damage-associated pattern receptors, DAMPs, which present signals of damage and are recognized by pattern recognition receptors, and these are expressed by different innate cells. In cytokines, the INF gamma and INF alpha are overly expressed in vitiligo. The INF gamma is a cytokine that is mainly involved in the proliferation, inhibition, apoptosis, and immunodeletion process. In vitiligo specifically, it inhibits melanogenesis and increase ROS release and induce their senescence and apoptosis by CD8 positive cells. The TNF alpha activity is increased in active vitiligo lesions, induces melanocyte dysfunction and cellular death. So innate cells, as I just mentioned, are the ones that express the pattern recognizing receptors on their membrane and in their cytoplasm. Innate cells in the cytoplasm and the cell membrane, as I just mentioned, express these cells. Some of these cells are ILRS, such as IRP1 and NLRP3, are activated due to oxidative stress or cellular damage in vitiligo. They are components of the inflammasome complex, and once activated, they release ILB1 and IL1. The inflammasome promotes the cutaneous T cell response. So some symptoms, patches and spots of lighter skin. The patches turn white due to the melanocytes being destroyed. Patches and sunspots burn easily because melanin is important in sun protection. The patches itch, hair turns white or gray, hearing loss develops, and eye color damages. The melanocyte damage is what causes a loss of skin color, and once the cells are no longer being destroyed, it leaves no pigment, so that is why white's seen, because there's literally no pigment in the skin. Skin that has lost pigment is more sensitive, so it sunburns more easily, and then sun is also a trigger for vitiligo, so it's really important that if you do have vitiligo that you are taking really good care of your skin. While it is spreading, there may be some itching, but there should be no overall discomfort. There's also melanin in your hair, what causes the color, so the melanocytes in the hair can also be attacked, causing premature graying and whitening of the hair. The inner ear actually has melanocytes as well, so the body can attack that, causing people to develop hearing loss, but that's really rare in this case. and vitiligo can affect the eyes, causing your eye color to change. It usually happens quickly and it's rare, but it could affect your eyesight, but it's not seen a lot. So diagnosis. So obviously you can just look at your skin and see I'm losing patches of pigment in my skin, so therefore you may have vitiligo, or there are other diseases that causes you to lose skin color. So the skin can be examined in a number of ways. See in this image, they are using a black light to see, and once you have vitiligo, the skin appears to be chalky and bright. You can have a blood test to see if you have an autoimmune disease. Eye examination, they're testing for uveitis, which is the inflammation of part of the eye that occurs sometimes with vitiligo. And they can take a skin biopsy to examine under a microscope to see if the tissue is missing melanocytes in the depigmented skin. And then for treatment, depending on age and how much skin is involved and how fast the disease progressed, there's different treatments that can be sought. And since the disease is non-lethal and is mainly just cosmetic, treatment isn't always very common. People usually just tend to just live with the disease since it doesn't affect their health in any way. So you can use medications that can control inflammation, such as a cortisone cream, which can possibly help return the color of the affected skin. This treatment is most effective in early stages of the disease, and it takes several months to take effect and has side effects such as skin thinning and being able to see lines on the skin. For the immune system, a calcineurin inhibitor and ointment might be effective for people with small areas of depigmentation. The FDA has warned that this medication can cause lymphoma and skin cancer. Some therapies use light therapy, which uses ultraviolet B, to stop and slow down the progression of active vitiligo, especially when used with medication prior. It can take up to 6 months to see results, and this must be done in a clinic. There is a smaller, portable, less risky portable device that can be used at home, which has mild side effects such as itching and redness, but that does clear up. And the treatment works by a specific wavelength that stimulates the dormant skin melanocytes. Also, there's combining postlurin and light therapy, postlurin is a plant-derived substance that can be used with light therapy to return the color of the skin. This treatment is effective, but hard to administer, and is usually replaced by other methods. And some people just choose to remove all of their normal skin color and just have it lightened to the color of their vitiligo affected skin. Surgery can be done with skin grafting, where doctors take healthy pigmented skin and transfer it to the areas of the unhealthy skin. Blister grafting, where the doctors create blisters of healthy pigmented skin and transplant them on top of blisters of discolored skin. Cellular suspension transfer is where the doctor takes some tissue of pigmented skin and puts the cells in a solution and then transports them onto prepared affected areas. And some future treatments are stimulation of melanocytes called alpha-menide, which is implanted under the skin to promote the growth of melanocytes. And they want to develop a drug that can control melanocytes called with prostaglandin E2, which is being tested to restore skin color in cases where vitiligo is not spreading. Thank you for listening.